A patient today asked about Intuniv or Guanfacine, and it's used for the treatment of adult ADHD. Now, Intuniv or Guanfacine is not FDA approved for adult ADHD, but it's used commonly in ADHD for children, and it frankly can be used off-label for treatment of ADHD in adults as well. Intuniv or Guanfacine is an alpha-2 adrenergic agonist, and this medication can actually basically opposes the sympathetic nervous system and can result in not only improved focus and less distraction and improved executive function and improved impulse control for individuals with ADHD, but it can also cause a decrease in blood pressure and bradycardia, so a slowing of the heart rate, and other cardiac side effects or effects if you're actually looking to produce those side effects for medical reasons. So because this medication can affect your cardiovascular system and can cause hypotension and bradycardia and can actually cause arrhythmias, it's incredibly important that you're under the direct supervision of a provider when starting this medication and when taking this medication, and if considering stopping this medication. It is a medication because it can cause lower blood pressure and bradycardia. It needs to be titrated to the right dose. So individuals will usually start off on maybe 1 milligram and then can increase by 1 milligram per day every week or every couple of weeks until you get to the clinically effective dose for a patient, which obviously would need to be within a certain range, usually up to maybe 6 or 7 milligrams per day. But typically most patients that I see who are on this medication may be on 3 or 4 or 5 milligrams, even the adults. When starting this medication, individuals may also have upset stomach, headache. They might feel more tired or sluggish. They might have just other side effects that are typically transient and typically go away with time. But again, because of the propensity of this medication to cause changes in your cardiovascular system, it is very important to have vitals monitored, or at least be under the supervision of a physician or medical provider that can make sure that it's not causing any harm to the individual taking it. But it may be a great option for individuals to take as opposed to your stimulant medications that have a much higher abuse potential. If you believe this video pertains to you in any way, you're interested in more about this topic, I recommend that you make an appointment with a mental health or medical provider to discuss options. These videos are not meant to be medical advice for anyone out there, just simply informative in nature.